So we last spoke 13th of February, Friday the 13th of February, which is 5 weeks ago now. This is Sunday the 22nd of March, Sunday the 22nd of March. Late afternoon, I've had a lovely day. I hope you've had a lovely day too. Spring has sprung, beautiful sunshine today. I had a walk around the old hospital grounds this morning with my family. The grandchildren came this afternoon. We got out into the garden to run about, so it's been really lovely. The last few weeks have been a little bit rough, and the real reason, I suppose the core reason for that is nausea, which is a new experience for me. I know I've mentioned it before, and I've had it a bit before, but really now there's an issue with nausea which I feel has been caused by the meeting place, if you like, the crossfire that I'm caught in between two sets of medications that I'm on. So at the moment I'm on chemotherapy, and the chemo drug that I'm on is cabazitaxel, and that comes with nausea, and it comes with a few other side effects. I'm on this treatment till the 8th of July, and this coming Wednesday, the 25th of March, I'll be getting my 5th of 10 doses of cabazitaxel. Cabazitaxel lowers your white cell blood count. As a result of that, the pattern at the moment is I get my chemotherapy on Wednesday. Thursday, Friday, Saturday I feel not too bad. Sunday, the 5th day of the chemo, I start injecting myself in the stomach with a drug called filgrastim, or a medication called filgrastim, and filgrastim is used to treat neutropenia, which is low white cell blood count. So it's essential, and I take that for 6 days. So from the Sunday through to the Friday, second week of chemo, I'm injecting myself every day. That also comes with nausea. Now I've got a good anti-nausea medication called metoclopramide, but I might need something stronger, because as well as the nausea caused by the chemotherapy and by the filgrastim, I'm on these other mental health medications. I'm on Keppra and aripiprazole, and that's like an anti-seizure and an antipsychotic medication that I'm on, and they can come with some dizziness, loss of appetite, loss of strength, lightheadedness and nausea. So I feel as if there's nausea in the air now in a way that there wasn't before. There is good news. My hair hasn't fallen out. Not that it would have bothered me. I was ready. I got it cut short in readiness, but it's not fallen out. I've had a slight side shed Mohican thing going on, but my hair's actually thickened and not fallen out. And I was told it would fall out, and it fell out with the last chemo 2 years ago. But I don't mind that. On a more seriously positive note, I've been relatively pain-free. I've taken ibuprofen and paracetamol a couple of times for hip pain, joint pain. But really, the main thing has been nausea. Nausea, lack of energy, lack of motivation, low mood. I'm sleeping 8 or 9 hours a night, which is great. My appetite climbs as the time goes past after the chemo. But the nausea is there, and I've had a bit of weight loss, which my oncologist was a bit concerned about. I'm slightly less concerned, because I'm not doing the steps I was doing before. I'm not doing my daily weight training exercises that I was doing before. And I have experienced loss of appetite, which comes with the medications that I'm on, the mix of medications. So I'm 78 kilos, which for my age and height is not unhealthy. In fact, I'm at the upper end of the BMI. If any further, and I'd be overweight. But I've been 80 to 84 kilos, more or less, since after my diagnosis. I was 74 at my diagnosis, because obviously I had lost weight. But I've had a great appetite up until the last few months. Obviously my oncologist would like to see me put on weight, and so would I, but I think that means recovering my appetite and also being able to put on some muscle, because the problem is I'm also on this hormone therapy. I get 3 monthly injections every 3 months. I get an injection of Prostab, which is a hormone therapy, androgen deprivation therapy, and what it does is it turns muscle to fat, so it softens your muscles. So there's a risk of muscle loss and with it osteoporosis, fractures. So I really have to be using weights, but I find it very hard to get motivated. I go to the Maggie's periodically on a Monday afternoon and do some lifting of weights there and some functional fitness class. But I'm not doing what I did before. And just to fill you in, before November, before I got the brain tumour, or the tumour at the base of my skull, I was doing 12,000 steps a day and 30 to 40 minutes of stretching and strengthening every day. Since November the 10th, I've not been doing that at all. This year I'm on 5,000 steps a day, which I do, diligently as I can, because I'm not doing other things. I'm not doing the weights, I'm not getting my mat out, my rubber band. And the reason I'm not doing that is lack of energy, lack of motivation, but also lightheadedness, nausea. And I'm taking the anti-nausea pills, but the nausea is staying low in the mix. It's low in the mix, which means that when I try to do weights or lie on the floor and do bridging and do these different strengthening exercises that I have to do, I feel weak. As I would put it myself, I feel weak as a kitten. And that's not me. I feel sometimes it's 10% capacity that I'm working at, or 40%. It's demotivated me. It's made it harder for me to read and to write, which are mainstays of my confidence. It stopped me from exercising, which is great for my well-being and my confidence. So I've definitely suffered a lack of confidence. I always say to people, when I used to go to the Maggies and people asked how I was, I would say fantastic, and it became a kind of catchphrase or cliche. But now I would say I feel fragile, I feel vulnerable, I feel trepidatious. Even when I walk now, I've walked on my own for years, and I've walked miles on my own for years, but when I'm out on my own, I'm very careful crossing the road. I never jaywalk, as I have done in the past. I'm very conscientious, and going downstairs I'm very careful. Now I'm 65 years old and I've got terminal cancer, so that might not seem unusual. And I suppose if there's good news attached to this, it is the fact, well, first of all, that I'm pain free, but secondly, that I'm much more understanding now. But I always was, I was never not understanding, but I'm much more understanding now of other cancer friends with cancer and Maggie's mates and so on, who have suffered from side effects. Because I was lucky, I sailed through chemo. I was a poster boy for chemo with the docetaxel 2 years ago. I sailed through 8 months of the radioactive isotope, minimal side effects. I mean, the first time round with the chemo, I had joint pain, hair loss, blackening of the nails and neuropathy. But this was nothing to me. I mean, I hardly insulted it with a paracetamol. So I've been lucky, and I know from other people who had neuropathy quite badly, who had pain greater than the pain I'm getting, that needed stronger medication and so on. So there are lots of positives. The positives are I'm sleeping well and I'm relatively pain free. Those are positives. The nausea is a new thing, it's a different thing. I've never suffered from sickness. I've never suffered from nausea before. So it's different, and it's definitely put me off balance. And being off balance has made it harder, really much harder to exercise. I will go to Maggie's tomorrow afternoon and I'll do the best I can to go around, and we're all at different stages and ages and conditions, so you're allowed to take time out and to have a sit down and to not push yourself too hard. But I really would like to get back into my daily routine, and I would like to get back to using weights. So when I see my oncologist, I'm going to ask them if there's any way of offsetting the effects of these various medications, or if there's a way of doing something about the nausea that's more effective than the drug that I'm on at the moment. The drug that I'm on at the moment which I take, does suppress the nausea, but I feel as if there's a background nausea, this nausea low in the mix, as I say, which is bothersome. So I'm hoping that something can be done about that, but it's treatment number 5 of 10 on Wednesday. Hopefully that goes okay, and at least I'm prepared now, and I see the pattern now. I know the pattern is 3 days after the chemo, I feel not too bad. Start the injections on the 5th day, start to feel a bit nauseous and so on. And I have, that second week is not a good week for me, but at least I know that there is a pick-up. And by now, by today, and hopefully through till Wednesday, I pick up enough that I'm ready for it. And I suppose that's why I get fulgrastim injections, or give myself the fulgrastim injections, is so that I've got some notes in front of me, because I always do these vlogs off the cuff, but the way my head's been, and it's not tiredness or wakefulness that I had from the steroids, it's just that slightly elsewhere feeling that you get, a slight state of mild mental confusion or cognitive impairment, that means that I like to have a kind of checklist or aide-memoire, as they call it, so that I know what I'm talking about. But that would be my concern at the moment, is can I do something about the nausea? Because the nausea, more than pain, when I had pain I took painkillers, but the nausea does definitely interfere with my quality of life and my confidence and my ability to do have a regular exercise routine, which I know is something that always lifts me up. So I'll leave it there, but that's where I am.